Hey everyone, it's been a while since I made a video. I feel like I say that every time I make a video now because I'm slacking off on this YouTube channel and on making videos, but like I say every time, life has just been crazy with going into a new department like labor and delivery, and now being pregnant, trying to get through my first trimester of pregnancy was hard while also working, but the second trimester has been better, but I've been just really busy. So no excuse, I know, but that's my excuse. So today I want to talk about a subject that kind of is personal to me because I just went through it, and I know that a lot of us right now are probably going through it with COVID and just the medical industry being kind of a focal point of a lot of things and kind of a wreck. And that is, and if you're coming here, I'm going to adjust this a little bit. If you're coming into the medical field right now as a new grad, it can be really tough to deal with the things that nurses are dealing with right now, like lack of PPE, shortages of resources, having benefits taken away. I've heard crazy things from Nurse Life RN when EB shares stuff about the things people are going through in other hospitals, and I'm just like, how are you going through this? Like, how are you having like vacation time taken away and benefits like stalled and like no raises? Like, it's crazy to me that nurses are having to go through this right now. So being a new grad during this time, I feel like it's easy to get a sense of new grad burnout, or any kind of burnout as a new grad. I don't know if burnout is like the proper phrase, because burnout is really more like when you've been in a certain department for a long time and it's starting to wear on you and you need to change. But honestly, I think new grads can experience burnout if they're thrown into certain situations, or you learn about this in nursing school. It's more like reality shock. I think that's more reality shock, burnout, just being overwhelmed as a new grad. And for me, I would consider being a new grad nurse as someone who's only been a nurse for about 2 years in the same specialty. So I was in postpartum for 11 months, almost a whole year, when I switched over to labor and delivery. So, and I've been a nurse for a year, but I haven't been on the same unit for a whole 2 years. So I'm still fully considering myself a new grad. And, I was in postpartum feeling pretty good about myself. And then I went to labor and delivery and I was like, oh my gosh, like total different way of thinking of things, total different way of processing things and critical thinking, which I love. I love the challenge, but, kind of going into like what I went through personally for the last 3 months. I was training in labor and delivery, loved it. Training's awesome because you get help and all of that. And I still get help, but you kind of more rely on the person orienting you to guide your decisions. Whereas when you're on your own, people will help you, but it really is just down to you making that decision. You feel the whole weight of you being the nurse. And I think labor and delivery is one of those areas where so much weight is on you as the nurse to make certain decisions, because you are the eyes and ears of the doctor more than anyone. Like, just like ICU, just like ER, like you are right there, just like any, nursing specialty or unit. Like, you're the eyes and ears of the doctor, and things you do can really change the entire experience for the patient. I've had a few instances where I went home feeling like, did what I do cause this? Like, did what I do cause this outcome or that outcome? And it was really hard getting off orientation and realizing like my personal judgment makes a really big difference in the patient's experience and the patient's care. So that's a big weight to carry. And then couple that with, COVID, starting out, right as I got off orientation, we're having to wear masks and PPE, which I'm fine with, but just add on like the extra stress of COVID patients. And then I got pregnant, which I'm so excited about, but as any woman knows, most women have like a pretty hard time your first trimester. Like, I was nauseous all the time. I was exhausted, fatigue, just mentally it was really hard to go into my first trimester. And literally a week or two after I found out I was pregnant, like, I was on my own in labor and delivery. And like I said, you're never on your own. Excuse me, pregnancy congestion, making my nose run. You're never fully on your own, but like, you're the nurse making the primary decisions about that. No one can come and do your job for you as that nurse for that patient. So that was a big weight to carry. So it made me, it really made the first couple months on my own really hard. There were days where I was like, and also another thing, right after I got off orientation, my coworkers kind of joked, like, you're being baptized by fire. I just had situation after situation that was really challenging, like having two patients that were both really challenging, like constantly decelling and both on Pitocin and both having epidurals, so every 30 minutes needing to be turned, and then suddenly their baby's heart rate's dropping. Like, literally, I had one night where I was in one room repositioning a mom because the baby's heart rate was dropping, and you pull up both of your patient's monitors in your one room, and I look at my other my other patient in my other room just to make sure she's good, and her baby's heart rate's dropping. I'm like, I literally can't be in two places at once. Luckily, I had an awesome charge nurse with me that night, and she was in my other room taking care of it. But you don't always have that luxury. Like, if everybody else is busy, like, I would have had to like fix this patient and then run to my other room and fix that patient. Like, you know, it was just one of those nights, and I kept having one of those nights like back to back to back to back on my own. So I felt like a burden to the unit. I felt like, you know, oh, everyone's always having to help me. Like, I know I'm a strong nurse, but this is really hard. And like, I don't see that with cockiness. I see that just because, like, I push myself to do hard things. So, and I came out of postpartum being a strong nurse, not by my own means, but people telling me that, and then into an area like labor and delivery where I'm like, oh my God, like, I'm not as, you know, I wasn't doing as good as I thought I did. But I think sometimes as new nurses, we put so much pressure on ourselves to be great, to do great, and that's good, and you should, because that pushes you. I'm going to make a video tomorrow about that. That pushes you to, you know, grow a lot. But you have to realize too, like, you're still new. Like, I've had to give myself a reality check so many times in this season of transition into a new unit and stuff about, like, you're still really new. Like, you're still a really new nurse. Even though you've been a nurse for a year, yeah, you should know the basics. Yeah, you should, but there's stuff that you don't know, and you're still learning how to work with these doctors that these other nurses have worked 20 to 10 years with, you know, and their relationship with this doctor is going to be different than yours. Like, you're not going to gain this doctor's respect overnight. You're not going to know certain things, like when to push with a patient, when not to, when to stop, when to change a position, and when not to, like, right away, like, you know. And so that's where you have to really realize, like, where your weaknesses are and how to strengthen them. Like, give yourself extra education, like, beyond what the hospital's given you. Reach out to your coworkers and be like, hey, here's my situation, like, what do you think? Have someone you trust, and like, be able to vent your frustrations and your fears to at work. I know that, you know, being a new grad, it's hard. You gotta like break into a unit, especially a unit like labor and delivery where I'm at. Everyone's so close-knit and tight because they've all been through crazy experiences together. So if you're in a unit like that, just keep holding on, keep like working really hard, you know, be there when someone else needs help. Like, there have been nights where like my two patients are stable but someone else needs help, and I run in the room and I help the best I can, and that's going to gain you a lot of respect as a new nurse. So I know we're all going through a really crazy season right now, and new grads especially are probably just struggling so hard because, you know, you're being thrown into situations where it's a pandemic, and just they prepare you in nursing school for this kind of, but not really. So just keep holding on. You know, if you love where you're at, but you're experiencing burnout like I was, just remind yourself that you're where you want to be, and that it's not going to last forever, that you are going to learn what you need to learn to be a better nurse in that area. or if you're in a place where you know that's not where you want to be for forever, start like a year in, start making those moves, start taking those steps to get you where you want to be. If you want to be an OB nurse, an ICU nurse, an ER nurse, start getting your certifications that you need to be able to apply to those positions. Start, get your BSN if you have to, start on your master's if you want to be a nurse practitioner. Don't stay somewhere forever because you think you have to. If you want to be somewhere else, a different department, a different specialty, start making the moves 1 year into being a nurse that you have to, or else, so that you don't get stuck somewhere that you don't really love and you get burnout and then it ruins nursing for you, So yeah, that just was what I was feeling to share. And tomorrow I'm going to do another video for new grads. So stay tuned, and what day is today? Oh, happy Wednesday. I'm 18 weeks pregnant. So almost halfway there. Super excited. And the second trimester is so much better than the first, let me tell you. But happy Wednesday, happy nursing. Bye.